Hello everyone, welcome to Physio Tribe. My name is Jay Bhausa. Thank you so much for all your love and support. Today we're going to discuss in part 4 one of the categories of 4 neck pain impairments. So far we discussed the assessment of cervical spine and a case scenario. The 4 categories were neck pain with headaches, radicular pain, movement, coordination impairment, and last but not the least, mobility deficit. In this, there is one category which is usually a little difficult for physical therapists to grasp, or they are a little bit confused. This I'm talking from the questions I have received from you guys and comments I've heard from you guys. That category is cervical pain with movement and coordination deficit. So I'm going to go a little bit deep in this category and give you an example of what these patients will present with. Some of the characteristics in these categories is the patient will present with long-standing neck pain, usually more than 12 weeks. They will have poor performance on CCFT test. It's cranial cervical flexion test. Now this test, you are basically trying to assess the strength of the neck stabilizers. The other test which you may perform is called deep flexor endurance test or neck flexor endurance test. The same thing, it is used to find out the strength and endurance of the neck flexors and the stabilizers. So patients in this group will have poor or substandard performance on these tests. I can go in the details of this test if you want me to, so please let me know in comments, reach out to us on Twitter or Instagram, and we can go deeper into the test, their reliability, sensitivity, specificity, etc. In this patient, you'll also notice strength deficit in longus colli, middle and lower trapezius, serratus anterior, those kind of muscles. And you will notice tightness and flexibility deficit in muscles such as scalenes, upper trapezius, levator scapulae, pectoralis minor and major. And then these patients will have difficulty with repetitive everyday activities. A typical patient would be, let's say, someone who is working on computer, which we see a lot of them these days, don't we? They, will have neck pain. It's a chronic neck pain, and during this time they have developed, tightness and stiffness and weakness in the stabilizers. So those kind of patients will not have headache, will not have radiating pain, and will not be categorized in mobility deficit, even though they may or may not have some restriction because of these tests and the chronic nature of the neck pain. The treatment part of it will be covered by me. I'm going to put out the treatment strategies and show different clinical treatment positions and techniques which I have learned over the period of 12 years of clinical practice. So I'm excited to share some practical tips which you can use to help your patients. Last but not the least, this is the part 4. After this, our next presenter is going to cover neuro. His name is Tahir Duliawala, and he's a dear friend of mine, a great physical therapist. He has done some tremendous work in the field, and he's going to cover management of spinal cord injuries. So it's going to be very exciting. Please follow us on Twitter, Instagram, Facebook, and please subscribe to our channel on YouTube, the Physio Tribe. There are a lot of physical therapists around the world in our tribe which are excited to share their experience and their journey. So you guys can help your patients succeed. And we want to share what we hoped and we thought we should have learned when we were in early stages of our practice. Thank you so much.